Good evening, everyone. My name is Brenda Ahlberg, Kenai Peninsula Borough Information Officer, and thank you for joining us tonight on the Community Conversation today. And with me is Dan Nelson, our Incident Commander. Good evening, Dan.
Good evening, Brenda. Good evening, everybody. So thanks so much for joining us, and I've got a little bit of a brief update for you, but certainly a welcome you back to our live stream. We took a couple evenings off while things were kind of in a steady state, and we're certainly glad that you joined us today. So let me go through a couple things. I want to recap kind of our cases and where we are with COVID-19 testing here on the Kenai Peninsula. So as of today, we have 213 total cases. On the Kenai Peninsula, we have a total of 13 cases. So over the weekend, while we were not broadcasting, we had a few positive tests, but I want to reiterate kind of where those tests are for people. In the Anchor Point community, we have 1. In Homer, 2. 1 in Kenai, 3 positives in Seward, 4 in Soldotna, and 2 in Sterling, with a total of 13 positive cases. A few of those cases, I just want to remind folks that it can be a bit confusing. This data comes from the Department of Health and Social Services, which follows CDC guidelines on testing. And one of the things that's come up in recent days is when we identify a particular case, for instance, in Anchor Point, that individual's residence was an Anchor Point. However, they were not in state when that case occurred, or when that death occurred, I think, in that case. So even though they're not in state, CDC's requirements on how they do tabulation of data across all 50 states attributes it to their residents. So that's why we mention these numbers and why those case counts are in those official numbers. To date, approximately 7,000 tests have been completed, and there's been a lot of questions on testing and some of the priorities, and when can we get tests done for everyone? And I want to address that just real briefly with some of the information that our healthcare partners have shared with us. The tests are certainly, we're at a point where a lot of the labs and different places that conduct those tests, which are both state labs here in Alaska and also private labs, similar to where your other lab work at your doctor's office may be sent. Those labs are done, are being sent out, and there's a backlog for testing for sure, as some of those labs are collecting tests from across the state and across the country. The test itself is not a simple test. It does take some manual work on the part of a lab technician to do that. Bruce Richards shared with us a little bit of that information here on one of these programs. So it's not a quick turnaround, not a high throughput. There has been discussion at the federal level about those high throughput tests. As far as we know here in Alaska, they're being manufactured and being readied just simply as quickly as they can, but we don't have those yet. And so the criteria that the Department of Health and Social Services has for our healthcare providers has everyone going through a screening process for symptoms. Right now, if you do not show symptoms, you will not be tested for COVID-19. If you do show symptoms, they may try and eliminate some other conditions before giving you a COVID-19 test. And that is a product of trying to preserve those tests and be able to get those done with the limited supply that we have. So as more of those high throughput tests become manufactured, that might change, but that's the information we have to date. Right now, there's currently no hospitalizations on the Kenai Peninsula Borough related to COVID-19. So that'll just hopefully bring everybody up to date on testing and cases and where we're at. Our incident management teams across the borough have been continuing with planning. We've had a great conversations and work with all 3 of our hospitals in the peninsula: Seward Providence Hospital, South Peninsula Hospital, and Central Peninsula Hospital. And I'm really pleased with how those healthcare facilities and really all of our healthcare workers have stepped up to make sure that everything that we can do, everything that we can get ahead is being done. So a real big shout out to the leadership and all of the folks that make those hospitals and healthcare facilities run. So we're continuing in that vein and just kind of reevaluating where we're at, and kind of waiting to see what conditions will happen here as we continue on with this experience. So just a real brief update to bring everybody kind of up to speed since we last talked on Friday.
Dan, one of the questions and I appreciate the fact that you've brought up testing and the concerns, but also from the data that is provided, that is from DHSS, and just reminding folks that that's not our data. That belongs, or I should say, that is provided from the state. Can you share from our perspective how that is drilled down to our local communities and what we've done on our hub, our information hub?
Absolutely. So let's talk a little bit about that, and I want to show folks a couple of tools here when we talk about our information hub. So all of the information, as Brenda said, is kind of aggregated at the state level. We're trying to bring that down and be a little bit more accessible to our residents. So when the state of Alaska just talks about the Kenai Peninsula Borough, or Kenai Peninsula, those types of things, that's not real helpful for a lot of folks. So let me take you through and show you kind of a little bit of an updated product that we have that I hope will be helpful to you. So give us just a second here as we get this set up. We did this successfully last time, so hopefully this will come through well. Stand by. So if you visit our blog, kpboem.com, that's, again, we've been talking about this. I hope everybody has had a chance to visit this, where you can see the up-to-date information on from all of the official agencies. But if you look over here on the right-hand side of the screen, you're going to see a link to the COVID-19 hub, and that's the borough's information hub that we maintain and help to aggregate data that comes down from the state level. If we go to that, I just want to point out a couple different things here as we look at this. We have a few links up here that I want to bring your attention to later, that bring into some drop downs that you can get information on. But here, if you look kind of right here on the center of our screen, you'll see case data based on residency. So you can drill down into the different communities and see where those cases are. And cases are reported, again, like I mentioned, per CDC guidelines. So we may have cases that are, and we know we do, that are attributed to communities on the Kenai Peninsula. However, those individuals are not on the Kenai Peninsula or not in the state. And that's how the state does that, and we have to follow that same thing with their data. You can scroll down and you can get some additional information that gives you information about the Kenai Peninsula Borough and some of the demographics. There's some great links to things, both our social media and the Alaska Department of Health and Social Services social media. You'll see some timelines here. I really encourage you to explore this, and there's some different options that are available to you. If you click on Maps, you're going to go into our map site here. We'll give that just a moment to load, and you'll see a couple different options that you can see. My mistake, I zoomed in there by accident. We'll get that back up. But this map, for instance, talks about borough facilities, whether they're open or closed, if there's altered information, and as well as many other area facilities. That was the Denina Health Clinic. If we click here, that's Division of Forestry. So there's different things that you can drill down into. If we look at the restaurant, food, and beverage services map, and forgive me as I'm moving around windows on my screen here so I can see the options. You can filter and look at some of the services based on options. And one of the big things here is whether pickup or delivery options are available to help us with our physical distancing. If I click curbside pickup, and I'm going to X out of this, I should be able to see, and there's not much data on here yet, but if I zoom in, I can see options that come into that. So if I go down to delivery, the same thing here, I can see those options. Now, there's not much data on this map right now, and what we're asking folks to do is we hope that you as business owners can help us populate this. And so I want to show real quick how to do that. If we have local business owners that are out there, to go up to the local businesses link. And we're going to ask you to take a survey, whether you're just a general business or specifically run for restaurants, food, or beverage. And so if we click Take Survey, for instance, here under General Business, it's going to prompt you for a few pieces of information. So the first one is your business address. And so we want you to find your business address, or find your business on the map using your address as the first step. So what I'm going to do is I'm just going to use a sample here at the Borough building in Soldotna at 144 North Binkley Street. And you can start typing that. That will pop up. And it'll verify where you have your business. If you come down here, you can put in the name of your business, business type, so that'll give you several different options there. And then your current status. Is your business currently open, closed, or in some sort of modified status? And let's say phone and online service only right now for the main Borough building. I ask you for your hours as far as opening and closing. You can type that in or use the toggles. So we'll say 8 a.m. here. And I can use the toggles on this one, oops, and go to 5 p.m. And you can put in any further details about your business. Phone number, email address, your website. And if I submit this, that will help populate that map that I was looking at earlier. And so we'd like to ask all of our business community throughout the Kenai Peninsula, especially if you have a retail business or a food service, grocery, whatever that happens to be, to help us populate that map and help provide some of those details that we're asking for on that filter or on that survey, which will help us populate. So now that we come back here, we can see that here's the information that I just put in. So that'll help people find delivery, pickup services, and other things, whether your business is open or closed. So that's a great thing. If you wouldn't mind, you'll see it just took me a few minutes to populate that. If we could ask everybody to help populate it, and that gives us that one central place for people to go in order to find information and to find your business. So there's a lot of other things on the Information Hub, but that's one new thing that we just rolled out today that I wanted to show folks and hopefully take a minute to use that. And up here, you'll also see some timelines, some of the mandates, the operations for the borough, and some of the other links and things that you can look at for how you can help and what you can do during the COVID-19. So this link is on kpboem.com, and it will be continuously updated throughout the incident. So I'm going to stop this share, and we'll go back to our regular display with Brenda.
Thank you for that, Nan. There's been a couple questions on the comment thread that it is useful information. So I see that folks will most certainly be taking advantage of those surveys. So greatly appreciate that demonstration. Okay, I was going to look at questions. Are you ready for a few questions?
Absolutely. Let's take some. If we've got some in the comment thread, we can have a good discussion this evening.
That would be great. Okay, let me pull that up just a moment. Okay. So some of the questions are with regards, and I can help answer this real quickly, as far as some of the city parks being closed. And I would recommend folks go to our blog, kpboem.com. And on the right-hand side of the blog, we have the city pages. And I would recommend you go to each one of those pages for their specific closures or restrictions. so that you have the most up-to-date information. Okay. Bear with me here as I open this up. I'm trying to
We're all dealing with technology today. So while you're doing that, I just do want to remind people when we talk about trails and some of these things and businesses that are open and closed, that hopefully soon you'll be able to find a great map on our hub. Just a reminder to make sure that we are keeping that social distance, that at least 6 feet. If you're having to go out for those essential errands, try and limit those trips as much as possible, and really think about the impacts that we're having. There has been some somewhat positive impacts that are maybe starting to be seen at the state level. So let's continue that and make sure. Remember, masks are recommended if you have a cloth mask or something to cover your face with. That is a new recommendation that CDC and the state have kind of changed some of their guidance on. That can help also slow down the spread of COVID-19. So appreciate everybody doing your part. Just don't forget some of those things as we go about our day. But hopefully we're staying inside as much as possible.
One of the questions that's come up is that are the hospitals providing tests? And we did have Bruce Richards come on to the 7 o'clock broadcast earlier and had described what exactly that meant at the hospital regarding drive-through testing. And could you go ahead and describe for folks that testing is available based on the provider's recommendation? Can you share with us what that means?
Certainly. So for most folks here on the Kenai Peninsula, it's a fairly easy way to get that test if your healthcare provider has recommended or referred you to take that. So as we mentioned before, there are going to be some probably some other steps. You will go through likely a verbal screening process on the phone before being asked to come in anywhere, and your provider will help determine what laboratory tests you might need. So that can be either COVID-19 testing, that could be some other type of blood work or similar lab work to rule out other conditions before going for the COVID-19 test. Again, remember, those testing right now is limited. We do have a good supply on the peninsula, but we certainly don't have a supply for every person. And again, if you're not showing symptoms, current guidance is that you will not receive a test. So the first step is to call your provider. Remember, don't go in, give them a call first, see what they recommend. They might go and talk over the phone. You might have a video conference with them, whatever that happens to be. If you are referred to a test, there are testing sites in the 3 areas, the Seward area, Homer area, and in Soldotna. So in Homer, the testing site is at South Peninsula Hospital. In Soldotna, same thing, it's at Central Peninsula. And essentially for both of those test sites, you'll drive up to a designated area. They'll have you call, and then somebody will come out to be able to assist you. They'll be able to do the test right then and there. They'll take the sample they need and get that sent off when they are sending those tests off daily to be processed. I believe that same method is in effect in Seward. Forgive me, I cannot recall right off the top of my head if that testing site is actually at Providence Hospital or if it's at another site in Seward, but I'm sure we have that information. I just don't recall it off the top of my head. So forgive me for that, but they'll right from your car be able to take the sample, take the test. Generally won't have you go into the hospital, as we're trying to limit the spread of things inside those healthcare facilities. And then you'll hear from your provider. The provider that ordered the test will get the results back and they'll share it with you.
Okay, I'm not seeing any more specific questions to testing. There has been some comments regarding the parks in Soldotna, and yes, the city of Soldotna has closed their playground areas, but again, please go to the blog and look at the city of Soldotna's webpage for specific information on how that may apply to both the playground areas and trails that they have within city limits, please. Coming back to some of the other things that we were trying to address, Dan, with regards to some of it's not COVID related, but a little bit of confusion with regards to the Division of Forestry burn suspension. Now, we certainly don't want to speak on behalf of forestry, but maybe just to remind folks why they are suspending the burn permits effective April 30th.
And yes, so the Division of Forestry did put out some information today. And if you have a burn permit or obtain a burn permit, and remember, we are in April, burn permits are required for burning. Those permits will be suspended after April 30th. And so that's being done basically for a few reasons, but the main reason is with the physical distancing that we're all having to do with the potential spread of COVID-19. If you'll remember, we have, firefighting, especially in the wildland world, can definitely be something that's in close contact. We have a lot of teams that have come up. So if we think back to the large fire season we had last year, we had many, many hundreds of firefighters and support staff that came from really all over the country, from Canada and those types of things. Right now, that travel isn't nearly as easy. And so with the physical distancing and with the additional requirements that are related to our COVID situation right now, the best thing to do is to just prevent. So we want to prevent those types of fires. We don't want to have a fire season in the middle of all of this, and where we may not have the resources that we're used to coming up. So we can get more information from forestry on that. I'm sure they're happy to answer questions, or we'll release additional information. But that's really the impetus for what they're trying to do, and it's something that we have talked about here in the borough quite a bit. Of what does our planning look like? What would happen if we had a fire near a residential area in the wildland? Then now, if we had to move people or be able to get information out, if you'll remember some of our public meetings and things, those was a standing room only crowd and trying to get information out, and that's not what we want to be doing right now. So I think that's a wise decision. So the take-home message there is, if you have burning and some of those things, get that arranged now before the end of the month.
Yes, that's a great takeaway for it. Looking back at the comment thread, I will shout out to Gary Turner. He's always been a great help with us here at the Kenai Peninsula Borough. And one of the things he's saying is that the Chambers of Commerce are already collecting information for delivery and takeout. And one thing that we will be doing while we launch this survey today is that we will be reaching out to the chambers tomorrow, just for that very reason, to help try to populate some of that information a little bit faster onto our information hub. So thank you for that, Gary. We appreciate that. I don't have any more specific questions here, Dan, but I would like to take a moment to talk about our upcoming broadcast on Thursday. We are going to be having Cassidy Cameron, she's the city manager for Seldovia, talking about some of the additional protocols that they put into place for Seldovia, and wanted to just punt that back to you as far as the support that our team has provided to the city, and what else you'd like to share with our audience tonight regarding Thursday's broadcast.
And I think it's going to be great to hear from Cassidy. It's going to be great to hear from our small communities. Many of us, of course, live in the Central Peninsula and our bigger communities, but the small communities certainly have a unique challenge when it comes to all types of emergencies, this one included, and maybe even this one even more so. So I think there's some great conversation to be had about helping to prevent the spread in those small communities. And we've been talking about, if there is something that were to happen, a cluster outbreak of those things in a community such as Seldovia, those resources are so much more limited that it really requires additional planning and additional considerations. So I'm looking forward to having that conversation and kind of getting an idea of what's happening in the Kachemak Bay area, specifically as it relates to COVID-19. We had a great conversation with Dorotha from South Peninsula Hospital. So I think this will be a good follow-up to that. I think for everybody, seeing not too many questions, we'll get back and double check on that comment thread before we close out for sure. But I think everybody right now is kind of in a little bit of a wait and see game. I know here amongst our partners, our cities, and our own incident management team, we've been trying to slow down a little bit and make sure that people are getting rest and that we're just kind of waiting for the next developments to happen. And it would be my guess that a lot of us are kind of doing the same thing. And, I've said it a couple times here, but don't become complacent. Please don't let kind of this slowdown or this pause or, some potentially positive news coming from the state to stop us from doing what we know is right. Staying inside, stopping the spread, checking in on our friends and neighbors, being social, not being socially distant, being physically distant, and being able to use technology and use these tools to connect with people is essential. And we still know it's a tough thing, but don't let up on that. Don't think that we want nothing to happen. We absolutely do want nothing to happen. That's our end goal, but we're not there yet. So continue to follow the governor's mandates. Let's give this some more time and let's get this taken care of together. So I really encourage folks to really think about that as we kind of get in this mode. I know it feels to us, we're in our 4th week fully of managing this. It feels like we're kind of in a rut or a certain mode, but we can't let any of us, whether it's us, whether it's our cities and hospitals, or everybody, all of the residents of the peninsula, become complacent with that. So, Brenda, did we have any more comments come in on the thread while I've been talking?
Yes, we have a couple more. What what are the food, or excuse me, how are the food banks doing? Are they in need of supplies?
Yeah, and that's a great question. The last time I checked in with them, that some of our food banks were a little low, and we're definitely in need. What I would do is I would call your local food bank. I know most of our major communities have one. Call and see what their needs are, and then ask them the best way to get those things to you, whether they're commodities or anything else. Some of our food banks, for social distancing, physical distancing, I keep using that word, social distancing, but physical distancing, they may request monetary donations or may have you take things to a drop-off point. So call your local food bank, get the things that they need so you can do the most good. And thank you for that question. I think it's important for all of us to realize that in this very, very uncertain time, a lot of our service organizations that are doing good are probably not getting the donations they normally would right now as people go through this uncertainty. So it's a great thing to think about.
And with that, Dan, I'm going to ask you for some closing comments. And thank you for taking the time to provide this update tonight.
Well, I want to thank everybody for joining us. Remember, we've switched to kind of our Tuesday and Thursday schedule, so we'll be here twice a week. If there are developments or things that change that, we'll certainly get that announced. And don't forget that you can keep up to date with things on KPB Alerts on Facebook and Twitter, kpboem.com, where you can link to that information hub. And if you own a business, put your information on there as well, and we'll be working to populate that as just another tool for people to use. Other than that, I think I said my piece. Let's stay the course. Let's keep doing the right thing. Um, I really appreciate that everybody that's been, really staying inside and helping us out and kind of getting through this new way of navigating with distance learning and online pickups for groceries and all these new things. For some of us, it's a pretty new experience. So definitely appreciate that. Continue to reach out to us with questions, and we'll get back to answering them. I'm sure if some questions pop up, we'll try and get them answered in the comment thread. But otherwise, enjoy your evening. That's all I have tonight. Thanks, everybody, and have a great evening.